My daughter Ada is currently using the Dr. Brown's specialty feeding system. She was diagnosed with a cleft lip and palate at our 20-week anatomy scan. She is making a lot of progress using the Dr. Brown's specialty feeding system.
So when a baby is born with a cleft palate, it can make feeding very challenging. And that's because the baby needs to get both suction and compression, which compression is kind of like squeezing the nipple. And when a baby has a cleft palate, it is very difficult to get suction because of the hole or the space in the roof of the mouth. Babies with cleft palate often need a different bottle than a typical bottle system. And the Dr. Brown's specialty feeding system is a compression-only nipple bottle system. There's a one-way valve in the nipple that makes the nipple be a compression-only nipple. The baby only needs to use compression or some squeezing of the nipple in order to get milk to flow. That's because of the one-way valve in the Dr. Brown specialty feeding system. The baby feeds with a specialty feeding system by compressing the nipple, and then liquid fills the nipple and it stays in the nipple because of the one-way valve. One of the reasons the specialty feeding system is so successful is because it is based off of the baby controlling the feeding. So it's infant-directed feeding. There are other times that bottles have used a squeezing method where you have to squeeze the liquid into the baby's mouth, but with the Dr. Brown specialty feeding system, it is all infant-directed. Another great quality of the specialty feeding system is that there are several nipple flow rates that can be chosen to match the baby's skill level. This can make feeding safer and more tailored to each individual baby. The Dr. Brown Zero Resistance specialty feeding system can really be used through the continuum of feeding all through the baby's time when they're bottle feeding. So the baby can use the bottle right after birth when the medical team decides the baby's ready for feeding, through surgery, and then because it is a Dr. Brown Zero Resistance bottle system, the bottle can be used even after surgery. And after surgery, the baby can continue using the bottle. The family can just remove the infant pace feeding valve and it can be used like a typical bottle system. With the Dr. Brown's bottle system, it's zero resistance. So there is no buildup of pressure in the bottle, which makes it easier for the baby to feed.
With how the bottle functions, she is not getting excess air while she is eating, which is really nice because we do not have to stop her multiple times during a feeding to burp her. It is really easy to use. My husband, my mom, the whole family is able to feed her without any issues.
This bottle system is used all over the world and is preferred by parents and healthcare professionals. With the use of a Dr. Brown's specialty feeding system, babies often go home sooner from the hospital. They learn to take their whole bottle sooner than if they weren't using this bottle, and they gain weight faster. All of Dr. Brown's bottle systems are reusable, and parents say the specialty feeding system is easy to use, easy to clean, and also an affordable option.